Okay, so in this lecture, I'm going to provide a brief overview of the neurobiology of nicotine, as well as its short and long-term effects. So before I really get into the neurobiology, I just wanted to mention a couple of things about nicotine. First, it is absorbed through the oral and nasal mucosa, through the GI tract, and through lungs, but it's most readily absorbed through the lungs, which explains why it is preferentially used via smoking. Nicotine in pipe and cigar smoke is not as readily absorbed as nicotine from cigarettes, and this has to do with the lower acidity level of the tobacco in pipe and cigars. And this may explain why these modes of administration are just not as addictive as cigarette smoking. And then finally, I want to mention that nicotine that is administered via smoking cigarettes takes about 7 seconds for the nicotine to reach the brain, and that's a really rapid rate of onset of its effects. And as a result of that, that may actually account for why nicotine is such a powerfully addictive drug. All right. Um, so, how does nicotine work? Well, so nicotine acts as an agonist at the nicotinic acetylcholine receptor sites. These receptors are widely distributed throughout the brain and the body, and as a result of that, they stimulate the release of most neurotransmitters, including both dopamine and serotonin, which is we'll talk more about, which is where it gets its reward and mood elevating effects. It also is involved in the release of adrenaline. Some of the effects of acetylcholine include increases in blood pressure and heart rate, increases in GI activity, and this may in fact be why people choose to smoke after eating to help with digestion and regularity. It increases arousal and attention. It also has an impact on learning and memory, elevates mood, and also has an impact on REM sleep. Nicotine is actually believed to have a biphasic effect, such that at lower doses, activation of these nicotinic acetylcholine receptors produces arousal, whereas at higher doses, it actually interferes with neural transmission, resulting actually in a depressant effect. So nicotine actually gets its rewarding effects by, we've mentioned this before, it gets its rewarding effects by increasing the amount of dopamine that gets released into the synapse. And it increases dopamine transmission through stimulation of these nicotinic acetylcholine receptors. Now, there are a lot of different NACHR receptor subtypes. The one that seems to be the predominant subtype in the brain and also is the one that's believed to be the main receptor that mediates nicotine dependence is the alpha 4 beta 2 nicotinic acetylcholine receptor subtype. And this is supported by actually two pieces of research. One is research with beta 2 knockout mice, in which case they knocked out the beta 2 gene, and this actually eliminates nicotine self-administration in nicotine-dependent mice. And when they've also found that alpha 4 is important in sensitivity to nicotine. It actually mediates the sensitivity to nicotine reward. And it also plays a role in the development of tolerance and sensitization to the effects of nicotine. So as can kind of be seen in this graphic, in the short term, nicotine actually stimulates these nicotinic acetylcholine receptors to release glutamate, and this leads to increased dopamine release in the nucleus accumbens, which gives its rewarding effects, and in the frontal cortex, which may be involved in its attentional effects. So I'm just going to quickly show you a graphic. My apologies, it's taking me a second. Okay, a graphic. So this is an acetylcholine neuron. It has a nicotinic receptor here on the postsynaptic cell, which is a dopaminergic neuron. And we have some sodium ions, positively charged ions. So without nicotine, acetylcholine is released. It binds to that nicotinic receptor. The sodium ion enters the cell, triggers release of dopamine, but then there's brief receptor desensitization, which means that it will not be available to fire for a short period of time, and then after that brief hiatus, the receptor becomes resensitized and then can fire again. So with nicotine, what happens is that that nicotine will bind to the nicotinic receptor, allows the entry of sodium into the cell, but nicotine also binds to these other receptors on that postsynaptic cell, leading to an increase in the release of dopamine, which produces an increase in this sensation of pleasure. And I'm going to come back to this because it also sort of gives a demonstration of what happens in independent smokers. But one of the things you'll notice is that so during, absent nicotine, there was actually this receptor desensitization, but that doesn't seem to be happening, at least during the early stages of nicotine administration. We'll see that that actually resumes and becomes actually more powerful once people kind of become chronic smokers. Evidence for the role of dopamine as the mediator of nicotine reward comes from research showing that lesioning those dopamine neurons in the reward circuitry actually prevents nicotine self-administration. And I don't know if I've mentioned intracranial self-stimulation, but it's this idea that you put an electrode in the brain of an animal that is implanted directly into the reward circuitry, and the animal can press a lever to have a little bit of a very minor electrical stimulation that will actually get that area to activate. And animals will press that lever hundreds of times and forego other sources of reinforcement in order to be able to press the lever. And what the research has actually shown is that nicotine actually increases the reward that animals experience as a result of this intracranial self-stimulation. So, it's highly rewarding even without nicotine, but it's even more so. They get greater sensitization to the rewarding effects of intracranial self-stimulation. One other way in which nicotine increases dopamine levels is that in chronic smokers, it actually reduces the levels of monoamine oxidase A and B, which are enzymes that metabolize the monoamines, that's dopamine, norepinephrine, and serotonin. As a result of reducing these enzymes, this actually leads to an increase in dopamine and norepinephrine availability in the synapse, and again, leading to an increase in pleasure associated with smoking. So in terms of tolerance withdrawal, with chronic exposure, neuroadaptation in the form of upregulation of neuroacetylcholine receptor subunits, meaning more of them are developed due to nicotine-mediated desensitization of receptors, means that there's more opportunities for that increased dopamine release to bind to the receptors. So what happens is that that increased responsiveness or the increased availability of these receptor subunits actually means that when the person stops and dopamine falls down to sort of normal levels, it's insufficient to activate those receptor sites. And what we find is that this happens very quickly. So craving and withdrawal are due to the increased responsiveness, right? So they're desensitized as a result of chronic nicotine exposure. They become responsive after a brief period of abstinence, such as during nighttime sleep. And then because they're responsive, that actually triggers the experience of craving and withdrawal. And so there's some thinking that smokers maintain the alpha-4 beta-2 receptor subunit in a desensitized state through chronic nicotine consumption, and that actually is what helps them to prevent withdrawal. And in fact, it may account for why some really heavy smokers actually wake up in the middle of the night to smoke, because that resensitization overnight triggers actually craving and withdrawal while they're sleeping, which wakes them up and they smoke a cigarette so that they can go back into that desensitized state. Okay, so not going to talk in a great deal about this, just want to mention some of the physical and behavioral effects. So this increases energy and behavioral activity, produces mild euphoria, and people will mention elevated cognition, in particular elevated alertness. Some people think it actually enhances short-term memory, and its effect on acetylcholine would make sense. Some of the negative effects include nausea and vomiting, but this actually, tolerance to this develops really quickly. And I think I've mentioned this before that usually the first time someone smokes cigarettes, they often feel really sick. But the reason that people continue smoking, part of it is the social reinforcement, but part of it is that nicotine obviously has an impact on the dopamine system, and the tolerance to these negative effects actually develops so quickly, and the person stops feeling these way when they're um, smoking. All right. So some of the health effects, a couple things I wanted to mention about this. It's not really the nicotine, but actually other chemicals and tobacco products that cause the negative health effects of smoking. So, for example, it is carbon monoxide, which is related to the development of heart disease and that increased risk of heart disease. It's tar and tobacco that's related to lung diseases such as chronic obstructive pulmonary disease and emphysema and bronchitis. And then it is the chemicals formaldehyde, cyanide, and ammonia that are implicated in the development of various cancers. You'll also note here that smoking during pregnancy does have some long-term effects on the infant and child, right? So increased risk of miscarriage, stillborn and premature or low birth weight. But there's also some longer-term effects in terms of behavioral problems. And an increased risk of nicotine addiction later in life for a child who is prenatally exposed to nicotine. Okay, so of the some of the symptoms associated with nicotine poisoning. So this can actually occur if large quantities of nicotine are absorbed through the skin. Um, so actually, there's an interesting story. I don't remember where I read it, but about a tobacco farmer who was admitted to the hospital because of nicotine poisoning. And so when he got there, of course, they removed his clothes, put him in a hospital gown, treated him for the nicotine poisoning. He recovered. Um, did not have someone to bring him new clothes. So when he went to got discharged, he put the clothes on that he had come in with, and then ended up getting readmitted later in the day for nicotine poisoning again. And that was because of the nicotine that remained on his clothing. And so obviously it can produce some pretty significant effects, including, stopping breathing, um, and again, like I said, a lot of it's due to absorbing it through the skin. It's pretty rare and very difficult, I think, to produce this kind of intense level of poisoning with smoking because people usually get sick and vomit or get nauseous before they hit the severe um, levels of nicotine poisoning. All right, and then finally, symptoms of withdrawal, and this is one of the things that makes it so hard for people to quit. So it's really, a lot of people sort of complain about the irritability and anxiety as being one of the factors, the sleep disturbance, a big one. Weight gain. People often complain about weight gain and that can be a significant deterrent, and the cravings get really powerful, and that actually also gets people to give up on quitting. But another symptom that's actually not listed is constipation. So I already mentioned earlier that it does have an impact on GI motility. And so when people are smoking, it helps with regularity. And when they stop smoking, they find that becomes problematic for them. You're also going to note when you read in your readings that actually it has nicotine has an effect on certain psychiatric symptoms as well, that it has some effects on or interacts with certain psychiatric medications, and that's something that has to be kept in mind, especially when people are quitting. In fact, one of the interactions is that nicotine reduces the effects of caffeine, and so when people quit smoking, they're often cautioned to cut down on their caffeine consumption because they will find that they're experiencing higher levels of arousal associated with caffeine consumption when they stop smoking. And that may in fact be experienced as aversive. All right.